Good evening. I'm Jake Hummel, President of the Missouri AFL-CIO. 2 years ago, Republican politicians, led by our current governor, Mike Parson, tried to push through legislation that would take away working people's rights. We, the working people of Missouri, fought back, and we won. This November, we have the opportunity to do it again. We have the chance to once again beat Governor Parson's Jefferson City swamp and stand up for working families by voting for my friend, Auditor Nicole Galloway. This pandemic and the economic fallout it has caused have put enormous strain on working families in every corner of our state. What Missouri workers need right now is strong leadership to see us through. We need a leader like Auditor Galloway in the governor's office who will stand up for our jobs, our kids, and our health care. Auditor Galloway's track record of fighting for Missouri working families makes her the most qualified and capable candidate for governor. She comes from a working family, understands the struggles of working parents, and stands on the side of taxpayers against waste, fraud, and abuse. She stood up to the insiders and fights every day for us. She is the governor Missouri needs right now. I'm honored to introduce my friend, Auditor Nicole Galloway, the next governor of the state of Missouri.
Thank you, Jake, for that warm introduction, and thank you for your support. Good evening. I'm State Auditor Nicole Galloway. Growing up, I never expected to be speaking to you as the Democratic nominee for Missouri governor. See, I don't come from a politically connected family. I was raised in Fenton, Missouri. My mom's a nurse, my dad an engineer. My favorite subject in school was math. And like many families, my parents taught their kids the value of a dollar and working for what you earn. Running for political office wasn't something that I grew up thinking about, but my desire to serve is strong. It always has been. In the short time I've been in public service in Jefferson City, I've seen what's wrong with our politics and our government. When I launched this campaign for a new way for working families nearly a year ago, I never could have imagined where we would be today. But I knew then that Missouri's working families needed change. I'm even more certain of it now. As I speak to you tonight, I am mindful of the devastating toll the coronavirus has had on the health of our people and our state. Nearly 1,300 of our friends and neighbors have lost their lives to this virus since March. People who we celebrated the holidays and New Year with, many who were perfectly healthy earlier this year, have been taken from us. More than 200,000 of our brothers and sisters, spouses, or neighbors are currently out of work, with no idea when they will be back to their job or if they'll get hired, anxiously waiting and praying for their next paycheck and the dignity and pride it brings. Over 100,000 Missourians have lost their health coverage since March. Health insurance coverage that their families relied on in the middle of a pandemic. Hundreds of thousands of parents, teachers, custodians, bus drivers, food service workers, and administrators go to sleep tonight anxious. I know that they are anxious because I'm also concerned about how the school year will start. If it's safe, if my son's teachers have the resources and supplies to keep kids safe. And you cannot turn on the nightly news without seeing another 2,000 positive cases a day. The trends are all going in the wrong direction. No one person caused the coronavirus pandemic. No single person caused businesses to shutter. Our system has been shaken to the core. We as Missourians have been tested. And we look at the heroes among us who have stood up during this pandemic. The nurse who raced back into the hospital, risking her own safety to protect others. The paramedic and police officer who sped to the call, not knowing if the person they were responding to was infected with COVID or not. The grocery worker who restocked the shelves, putting their own health on the line to ensure their communities had necessities that they needed. The doctor who hasn't been home in 4 weeks so she wouldn't infect her little ones at home. Her call to service, providing the best care to her patients during this pandemic, was greater than the missed art projects and the warm embrace of her kids. These and so many more embody the spirit of this great state. These brave men and women rose when they could have sat, ran into the storm when they could have walked. And for those decisions and the continued courage, perseverance, and steadfastness, we are forever grateful. The one thing these frontline heroes did was act. Act with conviction, act with courage, act with speed. Unfortunately, their urgency was and continues to be met with hand-wringing, political calculation, and the swamp of Jefferson City. We are at a pivotal moment. We are facing big problems. The virus, our victory over it, and recovery from it will be the defining issue of our time. The most important thing the next governor will have to do is contain the spread of the virus and rebuild Missouri's economy. The question is, will we take the steps needed to defeat the virus and rebuild in a way that helps working people get back on their feet? Or will we continue to ignore the science, distract, and rebuild for only the well-connected special interests? I'm running for governor to put Jefferson City back on the side of working families and act with urgency to protect our fellow Missourians. In times of crisis, unrest, and uneasiness, public officials must step up, take control, and act. Never before has it been so clear the decisions our governor makes have a dramatic impact on our daily lives, especially in times of crisis. Our state is dealing with many challenges. A pandemic that has disproportionately impacted our most vulnerable communities, an economy that's leaving too many Missourians behind, and a state government that cares more about what political insiders want than the urgent needs of our communities, small businesses, and families. Governor Parson had his chance. He failed the test of leadership. It's time for a change. When it became clear this spring that the governor needed to issue a statewide order to flatten the curve, Governor Parson resisted. He was slow to act. Then in May, he penned an op-ed in the Washington Post, claiming credit for not issuing strong guidance, declaring mission accomplished. In May, when public health officials urged Missourians to wear a mask, Governor Parson instead stood up for those who wanted to defy public health and local government guidance. He went to campaign rallies and revved up his supporters by saying he wouldn't issue a mask rule for Missouri. He waited to order the schools to close until all of them already had. Then he spent the next 3 months doing nothing to prepare for them to reopen. As a mom, I'm eager for my boys to get back to in-person learning. It's vital for them. It's vital for our economy so that parents can get back to work. We had a limited window of opportunity to keep district reopening plans on track, but it all depended on where we were with the virus. Instead, Governor Parson went on the radio in July and said it didn't matter how bad COVID was in our state, that kids are gonna get COVID when they go back to school, but they'll just go home and they'll get over it. For our kids, for our families, our teachers and school staff, in Governor Parson's mind, we're all just gonna have to get over his failure to lead. What Governor Parson doesn't seem to understand is that this economic crisis is caused by a public health crisis, and the economic crisis cannot be solved. Schools cannot fully reopen for in-person learning until the spread of the virus is contained. He should have been stronger on masks, stronger on testing, stronger on contact tracing, stronger on PPE. He should have done more in partnership with our school districts this summer so they could prepare to reopen this fall. We need a strategy at the statewide level. Our teachers deserve it. Our kids deserve it. Working families need it. This past spring, so many Missourians did what they were supposed to do to flatten the curve. They gave up income, time with family, graduations, celebrations. Today, it's hard to understand what we have to show for it. Missourians will do what is asked of them. Will do what it takes to get through this together. We want clarity and leadership. We need a call to action and some urgency. Governor Parson had his chance. He failed. It is time for a change. When it comes to public health, Governor Parson just doesn't get it. I believe that when all the votes are counted, that Missouri will become the 38th state to expand Medicaid. Once again, we had to do what the politicians wouldn't. Access to health care is one of the most important determinants of economic success for working families. During an infectious disease pandemic, it can make the difference between life and death. Before this public health crisis, Governor Parson kicked 100,000 kids off of their state health insurance coverage. I've met some of these kids. I've met their mothers. They didn't do anything wrong. But when they showed up to scheduled appointments, they were turned away because their coverage had been canceled without them even knowing it. In parts of our state, you have to travel hundreds of miles for critical care because rural hospitals are closing down at an alarming rate over the last several years. They've gone broke because the number of uninsured patients seeking care just kept on rising. Here in our state, Black Missourians are dying from COVID at a rate that is 6 times higher than white Missourians, a rate that is much higher than the nation as a whole. It didn't have to be this way, and now we're doing something about it. Expanding Medicaid brings our tax dollars home to invest in our people, giving coverage to working folks, saving healthcare jobs, and creating new ones in parts of our state that desperately need them. Even before this current crisis, healthcare was the voters' top concern. People want healthcare that is accessible and affordable. And I believe that Missourians that are blessed enough to have health care want that for their friends and neighbors too. Governor Parson is part of the old way, the entrenched system. The well-connected insiders that fund his campaigns get what they want. And they don't care about the lack of health care for 250,000 working Missourians. The corruption of our politics and our government is how Governor Parson got to where he is. The gifts from lobbyists, the favors for friends, the campaign contributions from regulated industries. It's no wonder folks feel like the system is rigged to work for insiders and not them, especially when the cost of healthcare and everything else just keeps going up. This November's election will be critical when it comes to healthcare for Missourians. Because as we have seen, Governor Parson has a track record of thinking he knows better than the voters. I believe Governor Parson will undermine our vote in favor of Medicaid expansion. History can be our guide. On Clean Missouri, on Right to Work, Governor Parson thinks he knows better than you. He campaigned against Medicaid expansion and said he'd raise taxes and cut other programs if you voted for it. I take him at his word. I've said all along that Medicaid expansion brings billions to Missouri, the best economic development deal we've ever seen, and that we can expand health care without raising taxes or cutting other programs. As governor, that's exactly what I'll do. Governor Parson won't. So it matters who is sitting in the governor's office next year when it comes time to implement Medicaid expansion. And we need to turn our attention to the cost of care and the cost of prescription drugs for those who already have insurance. As Missouri recovers from the devastating health effects of this virus, our people need health care that is accessible and affordable. There is nothing more important than the health and well-being of the people of Missouri. Governor Parson is offering nothing to address it. In fact, on his watch, healthcare has become more expensive and far too many working Missourians have lost their insurance coverage. Governor Parson has no plan, he has no vision. I don't know that he cares. I do. As your governor, working people will be at the center of everything we do with working people at the table. We need a reset on our coronavirus strategy. I'll convene public health experts, business leaders, workers, and parents. We need universal testing. Our healthcare providers and first responders need the supplies and equipment to do their work safely with a stockpile in reserve. Our school districts need all of that too, along with clear guidance and data on how they can initiate a reopening plan, keep kids and staff safe, and stay open. Those facing hardship, without work, still need a hand. This isn't over, so the need for the safety net remains. Healthcare, recovery, rebuilding, these are at the heart of my case for change. I thank those of you that have put your faith in me to carry this fight forward into the general election. As your state auditor, I've never settled for things just being the way they are. I've gone after corruption and waste, finding $350 million worth, leading to 60 criminal counts brought against corrupt public officials, both Democrats and Republicans. As a mom, I don't settle when it comes to my family's health and well-being. As your governor, I won't settle either. I want Missouri to be the best place in America to put down roots, to raise a family and start a business. We have a lot of work ahead of us, but I am ready for this campaign, and I am ready to lead Missouri. And if you're ready to join me, please get involved. Visit NicoleGalloway.com to get started. We can't just go back to where we were on the eve of this crisis, because where we were wasn't good enough for too many Missourians. We will get through this together. Hope is on the horizon, but we can't wait anymore. The time is now. The urgency has never been more clear. Let's go.